I still have so many doctors that will refuse to treat the pedal loop in the foot. They'll turn on the faucet. They won't fix the plumbing below. So the plumbing below can't support the additional flow from the faucet being turned on above the knee. And these patients just sit there in pain and they're suffering. And the doctor's telling them to go walk, walk, walk. You don't have a wound. So there's no reason to open up, no indication to open up any of the vessels below. And they'll even say, the patient says, hey, I have tingling, I have numbness. I mean, I have neuropathy in my foot. I have burning. Like, why aren't you going to treat me? Well, you don't have a wound. So there's no indication. It'll just increase your chance of amputation. But then I see doctors like you, Dr. Patel, and you, Dr. Joye, that really listen to the patient. You hear what they're saying and you treat the symptoms that and you provide the relief to get them out. The whole point of any of these procedures is to get them walking, and they're not going to walk if you don't relieve their symptoms, all of their symptoms, or as many as you can, right?
Absolutely. And, the ischemic rest pain is pretty severe. It's like I tell some of the family members may not understand the type of pain the patients are going through. And I explain to them and tell them, say, if I put a tourniquet on your arm and keep that on all day long, that's the kind of pain these patients are suffering, So imagine you going for a blood draw and they put the tourniquet on and left it on for 5 minutes, that really creates a lot of ischemic pain. And that's what the patients are going through. And explaining that to the family member, I think it opens up their mind to saying, these patients are really suffering. The pain is real. I find that explanation to be very accepting for the family members to understand what they're going through.
It's that same tourniquet that we could apply to the legs of the surgeon that says walk flippantly. Walk in their shoes for a day.
Exactly.
It's just a miserable existence.
Yeah, a lot of these patients can't walk. I mean, that's why, they're there for you. And patients who have wounds, they have wounds in their feet. They're told to offload and not to walk. And then here we are telling them to walk. So I've come up with a little exercise that I tell these patients who have wounds, who are not able to walk. I tell them, imagine you're driving your car and you're pressing on an accelerator pedal all the way down and then bringing your ankle back up all the way, just doing those flexion and extension moves of your ankle, while you're sitting in the doctor's office, while you're watching TV, do that 30 times every hour. That is essentially almost like walking. So you don't, have to wait to get a, bicycle or anything like that. This can be done anywhere. And I had a patient who took my advice seriously. I told him to do it 30 times every hour, and he felt so good. He started getting more strength in his legs and calf and stability when he stood. So he does it 100 times an hour now, every day. So, when he's awake. So simple things like that I've learned from patients. They tell me, oh, I'm doing this, so it's helping me. And you can share those experiences with other patients as well.